In human body, there is a pair of filtration and excretory organs. They are called kidneys. The filtration function of the kidneys occurs in about 1 million spherical structures, and these spherical structures are called glomeruli. Under normal conditions, the plasma protein in the glomerular capillaries is controlled by the intact filtration barrier and goes along with blood flow. Only micromolecular substances such as metabolites of normal organism, creatinine, and micromolecular protein can go through the filtration barrier into renal capsular space. And then be passed out with urine. Pathological changes in different parts of the kidney lead to different pathological types of kidney disease. IgA nephropathy is a glomerular disease that is characterized by IgA immune complexes depositing on glomerular mesangial areas, leading to proliferation of mesangial cells and mesangial matrix. The main clinical manifestation is hematuria. Proteinuria may also occur in some cases. IgA nephropathy, infection of respiratory tract, urinary tract, and intestinal mucosa can cause mucosal bone marrow axis dysfunction so as to produce abnormal immunoglobulin A1. As antigen, abnormal immunoglobulin A1 stimulates immune system to produce corresponding antibodies. The combination of antigen and antibodies generates immunoglobulin A immune complexes. At the same time, abnormal immunoglobulin A1 has self-aggregation ability, which is easy to form immunoglobulin A1 multimers. Immunoglobulin A1 immune complexes and multimers can go into kidneys with blood circulation and deposit onto glomerular mesangial cells, activating mesangial cells so as to lead to proliferation of mesangial cells and mesangial matrix. The activated mesangial cells release various cytokines and inflammatory mediator to activate endothelial cells. After this activation, connections between endothelial cells widen and red blood cells are close to endothelial cells and are rolling, adhesion, and deformation in the edge, while the broadening endothelial cell feature and some fractured basement membrane. Red blood cells reach renal capsule. During the process through renal tubular, red cells will have various types of deformation, leading to hematuria. There are three main manifestations of hematuria. First, the deformation rate of red blood cells in urine is over 80%. Second, the deformation forms of red blood cells is over 3. Third, among the abnormal red blood cells, spur shape or spinous shape of red blood cells is over 5%. In IgA nephropathy, aberrant proliferation of mesenchymal cells and mesenchymal matrix were observed under light microscope. Electron-dense deposits in the mesenchymal region are observed under electron microscope. Mass IgA deposits along the glomerular mesenchymal region.
Hello everyone, this is the nephrologist online video consultation of Peking Tung Shin Tang Hospital of Traditional Chinese Medicine. And today we have invited Professor Zhang Bin, and he will talk with us about this IgA nephropathy.
大家好，今天我们主要讲的题目呢，就是 IgA 肾病是一个什么病。
Okay, our today's topic is what is IgA nephropathy?
那么首先呢，我们要了解 IgA 肾病是一个什么样的病。那么 IgA 肾病它是肾小球的毛细血管细膜细胞病，是由于人体内外毒素导致肾脏的细膜细胞受损，临床上表现为血尿、蛋白尿或者是高血压等症状的一类肾脏的一个固有细胞疾病。
Okay, first of all, we should know that IgA nephropathy is a glomerular capillary mesenchymal cell disease, and this disease is caused by kidney mesenchymal cell damage with the human body toxins. The clinical manifestations of this disease include hematuria and proteinuria and hypertension, are all related with this disease.
那么亚洲人的 IgA 肾病的发病率很高，其次呢是白人，那么非洲人当中较为罕见。除此之外 ，IgA 肾病的家族聚集倾向，其是家族性遗传对这个 IgA 肾病发病的影响。IgA 肾病是目前世界上发病率最高的肾小球疾病。IgA 肾病它是一种进展性的疾病，起病后每10年大约有20%可以发展到中末期肾病。
Okay, Asian people have a high incidence of IgA nephropathy, and then followed by white people and rarer for African people. In addition, the familial aggregation tendency of IgA nephropathy indicates that the influence of familial inheritance on IgA nephropathy is the most common glomerular disease in the world. And also this IgA nephropathy itself is also very common. IgA nephropathy is a progressive disease, and about 20% of patients will develop into this end-stage renal disease within 10 years after the onset of this disease.
那么它的疾病呢，主要表现为尿血、尿蛋白、高血压、水肿和肾功能的下降，其中反复发作的肉眼血尿，或者是大量的蛋白尿、血压过早的升高和肾功能过早的下降，是 IgA 预后不良的一个主要指征。
The main manifestations include hematuria, proteinuria, and hypertension, edema, and also the renal function decline. Among these manifestations, repeated onset of gross hematuria, large amount of proteinuria, and the premature increase of blood pressure, and also the premature decrease of renal function are the main indicators of poor prognosis of IgA nephropathy.
那么尿血、尿蛋白、高血压和水肿，等等呢，是怎么引起来的呢？它主要是因为人体内外的各种毒素导致了人体的免疫功能紊乱，大量的糖基化异常的 IgA1 形成了多聚体和免疫复合物，沉积在肾小球细膜区， 最终导致了细膜细胞的增殖活化。
Okay, so how this hematuria and proteinuria and hypertension and edema results in? Because human body toxins can lead to the body's immune function disorder. A large number of glycosylation, especially the abnormal IgA1, forms a polymer and the immune complex. And this immune complex will deposit in the glomerular mesangial area, and this will finally lead to the activation of mesangial cells proliferation.
大量的活化的细膜细胞通过自分泌和旁分泌各种的炎症因子，刺激细膜细胞增殖和细膜基质的增生，并通过细胞因子影响到肾小球的内皮细胞和足细胞。
Okay. A large number of activated mesangial cells will secrete various inflammatory factors by autocrine and paracrine, stimulating the proliferation of mesangial cells and the mesangial matrix. It also affects the endocellular cells and also the food cells of the glomerulus through the cytokines.
内皮细胞活化自分泌和旁分泌的细胞因子，破坏了内皮细胞的细胞间连接，导致红细胞漏出到尿液当中，就形成了血尿。那么足细胞活化自分泌或者是旁分泌细胞因子，破坏了足细胞相关蛋白和足细胞的骨架，导致足细胞的屏障受损，血浆蛋白漏出到尿液当中，这样的话就形成了尿蛋白。
Endocellular cells activate autocrine and paracrine cytokine and destroy the intercellular connections between endocellular cells, leading to the leakage of red blood cells into the urine and the formation of hematuria. Food cells activate autocrine and paracrine factors will damage the sertolin cell-related protein and also the cytoskeleton, leading to the damage of cell barrier. The leakage of plasma protein will occur in the urine. This is the formation of this hematuria.
那么好的，各位朋友，这就是我们今天给大家要讲的 IgA 肾病，它是一个什么病？
Okay, dear friends, this is what we are talking about, and it's about what is IgA nephropathy.
那么知道了诊断之后呢，那为什么会得 IgA 肾病呢？明天的直播课程，我们再给各位朋友进行详细的讲解。因为只有知道了得病原因，才有办法进行治疗。所以呢，为什么会得 IgA 肾病，是治疗 IgA 肾病的一个关键。感谢朋友们的收看，下期再见。
After knowing about the diagnosis, then why we can get this IgA nephropathy, we will provide a detailed explanation for everyone on tomorrow's live broadcast, because only when we know the reason of the disease before carrying on the treatment, so we can why we get IgA nephropathy is the key to the treatment of IgA nephropathy. Okay, thanks for watching today, and we will see you next time. Okay, bye bye.